This patient was referred to me for endodontic consultation of the lower left side. Patient states that tooth number 19, the root canal was done a few years ago. Patient says tooth hurts to chewing on, to biting, and to cold. As soon as the patient tells you that and you're looking at a tooth with a previous root canal, you should know that this tooth is not the tooth that's responsible for the cold sensitivity. All right, so you immediately need to start looking at other teeth. This tooth can be sensitive to chewing and biting on, but it cannot be sensitive to cold. All right, so as I said, the root canal, according to the patient, was done a few years ago. The patient also complains of pain below the tooth in his jaw. So these are all the things that you need to pick up as the patient explains their pain, and you ask the patient, tell me about your pain, tell me about your symptoms. These are the things that you need to pay attention to. So pain below the tooth in the jaw, that usually means an infection, an abscess. Pain to cold on a root canal tooth cannot be. So you immediately need to investigate in the adjacent teeth and even the opposing arch. All right, so in this case, I asked the patient, I said, okay, the tooth behind the tooth you're here for, you're complaining about pain to biting and to chewing, has a crown. How old is that crown? Patient said the crown on tooth number 18, the crown is about a year old. So right there, you got your answer. Very likely, tooth number 18 is the cold sensitive tooth, the tooth that's sensitive to cold, because it has a history of recent crown, and the tooth number 19 is responsible for the pain in the jaw and pain to chewing and to biting. If you look at multiple angulation PAs, and you can see the periapical lucency here associated with tooth number 19. So take a look here. Coke bottle preparation, right? Periapical lucency here. Look at the distal. Look how long the gutta-percha is there. Okay, so overextended gutta-percha, no periapical lucencies. All right, so no periapical lucency there. Periapical lucency here. So I went ahead and cold tested tooth number 18, and patient pretty much jumped out of the chair. All right, so tooth number 18 is responsible for patient's cold sensitivity. Tooth number 19 is responsible for patient's pain to chewing to biting. And I explain all of this to the patient. You have two teeth, and each tooth contributes differently, a different symptom to you. So it's not just one tooth. And we went over options with the patient. I usually, in these cases, I tell the patient, if you can live with it, with the cold sensitivity, let's leave it alone. If you can't, then I'm going to have to go through your brand new crown. You may need a new crown and do a root canal for you. Regarding tooth number 19, patient will come back so we can redo the root canal. Next consultation was regarding tooth number 31. This patient had dental phobia and said tooth hurt a lot a few days ago, and her dentist put her on antibiotics, and now tooth feels better. So in cases where a patient has dental phobia, my exam is unfortunately limited because they're already are so stressed to be at my office. So I don't want to start poking around, tapping on their teeth, and being invasive about it. So I usually just look at the x-ray and look at the tooth clinically. And as you can see here, you can see amalgam buildup there. Good morning. Decay here, MO decay here. You can see a periapical lucency here. You can see some bone loss. some bone loss there. I would have loved to probe that area, but of course I couldn't. And take a look here. And clinically, you can see a sinus tract right there. That's the tooth number 31. And you can see the sinus tract right there. So this patient has dental phobia and extensive medical history. So I need to run her medical history with our anesthesiologist to see if she qualifies for IV sedation. Otherwise, she's going to have to go to an oral surgeon and have the tooth extracted.